doctors who specialize in women's issues, and it's such a thrill to be able to share information from brilliant, accomplished women doctors who can talk a little bit more, have more time to talk out things that we're either too nervous to ask when we're in the office or not really sure what it is to ask. So I've just had a great interview with tons of wonderful information, and I look forward to our exchange. But before we do that, I would love for you to introduce yourself, give us a little background on your history, what it is you do, your motivation, just some sort of familiar background.
Sure. Well, first of all, thank you so much. I am so really honored to be here and to be able to speak to you. And I am absolutely passionate about women's health. I am an OBGYN, really a gynecologist now, in private practice in Manhattan. I have been in practice since 1990, and I trained as an OBGYN and really spent the first 28 years of my practice delivering babies and practicing gynecology. Wow. And as I've aged, I've really cultivated an interest in women's health, obviously their health through midlife and beyond. And I also enjoy taking care of everyone's teenagers. It's kind of fun. It strikes a balance. Although I really made it my mission about 10 years ago to become much more knowledgeable about women as they transition through perimenopause and menopause, because I felt that there was really a deficiency in terms of the amount of knowledge we have. And I really felt that I was going to make it my mission to try to take care of my patients and hopefully get some knowledge out there and educate women about healthcare and enable women to speak to their healthcare providers, because as you and I both know, many women just don't have the time or the ability to spend time with their physicians, and a lot of physicians are very hurried and rushed. And I think conversations need to be started by patients, because if patients and women don't advocate for themselves, they may have a quick appointment with their healthcare provider and never really have the opportunity to have their questions answered.
I think that there's a couple of sides to that. So we know we have to go and get a checkup, and it's important to do, but we just want to get the hell out of there before we hear any bad news. Like, let me get out of here in case Absolutely. She says something I don't want to hear. So I think that there's this fear factor. We know we have to do it. Obviously, doing it religiously helps sort of prevent things or lessen the effect of something negative. But my real excitement about having this conversation with you is the hormonal roller coaster that each woman goes through in a lifetime is understated, misunderstood, and actually kept secret for most of her life, because some of it just doesn't seem appropriate, or women may be judged as a little crazy because they're acting different. And so we're very conflicted. But if we start with puberty and what's happening to a woman at that time, I'd love to go through that and your thoughts about a young girl just having that experience or about to have the experience. What do you recommend you tell her, and should she see you right away?
Right. Well, these are great thoughts, and I will tell you that I always say this to my patients. Hormones affect every organ system of the body, and so much of the psychology and organ systems and bodily changes and dealing bodily changes that women deal with as they transition through puberty, they also deal with as they transition through menopause.
Right.
And I've also told pregnant women over the years that, yes, they think about their bellies, but truly every organ system is impacted by hormones. So starting with young women, really, and a lot of my patients ask, gosh, my daughter got her period, should I have her see you. And my initial knee-jerk reaction is absolutely not, because the last thing I want to do is traumatize a young woman. Now, clearly, if a teenager has an issue that falls in my, domain, of course I will see them. But with young women as they, enter puberty, and the age can be very variable. There are many components.
What is it?
Honestly, anywhere from 9 to 13, 14. Some women don't get their first period until they're 16.
Really?
If women are very athletic, have a low BMI, they may menstruate a little bit later. Some women who are working out too much, or ballet dancers, people who are into gymnastics, women with eating disorders tend to be a little bit later. So, but on average, let's say they're 12. Prior to, when one looks at the transition through puberty, the last thing that typically happens is getting one's period. Young women start with some, pubic hair, usually first, and then a little hair under their arms, which we refer to as axillary hair, and then breast bud development, and then breast development. And ultimately, they will get their period. Once a young woman gets her period, that's when her growth, starts to sort of taper off. So if I had to generalize, many women who are sort of on the trajectory to be taller tend to menstruate a little bit later, but you can't really generalize. Again, the hormones that occur during adolescence will really affect every organ system. The brain, the ovaries, as they start to make estrogen, also make some testosterone, and testosterone's responsible for libido. So, young women may start to show an interest in, sex, sexual activity, and be aware of that. Also, they tend to sweat a little bit more. They may notice, changes in terms of, odors and, perspiration and things like that. And, skin also changes with age, as well as, pretty much every organ system does. They may notice a change in body hair, and women continue to develop. And as they menstruate, they undergo cyclical changes with their cycles. Again, everyone's different. Some women don't have regular menstrual cycles, but let's say the average woman might, except for clearly when she's pregnant or nursing, for example. And then starting around, I would say 46, 47 to me is always the magic number with patients. If I had to generalize, many women do start to have menstrual irregularities. It can start in their earlier 40s. And everyone's different. You hear women talk about menopause and you think it's a definite, finite moment in time, which it's not. It's really a transitional period. It can last 7 years. And again, how hormones affect every organ system of the body. They may notice a change in their libido. They may notice change in hair patterns. Their menstrual cycles may be thrown off. And these are all things they'll want to discuss with their physicians. In addition, there's a huge psychological component for many women. And as I mentioned, and I keep going back to the point that hormones affect every organ system, it's important to realize that there are emotional components. Many women face, you talk about the emotional and hormonal roller coaster. This occurs premenstrually as PMS. It can occur with women who are postpartum, and then absolutely during perimenopause. And I've seen so many women in my practice who don't have a prior history of PMS or don't have a prior history of postpartum depression, but all of a sudden they do present in perimenopause thinking something's terribly wrong.
Yeah, there's a
new anxiety, new depression,
right.
And sometimes it's really written off by their internists. They have palpitations, it's written off. And, you can really... So many of these things can be explained by hormonal changes, and it's amazing how when I can take care of a patient and manage things hormonally, how much better they can feel.
Yeah, I think the conversation about hormones is very important because it's almost, I've many times broken it down by decade, even half decade, because at each point, there are different things happening in our lives as women, and there are different expectations we have for our lives, and the hormones are going through their cycle, and we are affected emotionally and spiritually, intellectually, in every way. It's not just the physical, it's every part of us. And I often think about so at puberty, there's this revelation. Something dramatic has happened, and this little girl is not going to be the same. She is no longer that person that she was prior to. Leading up, yes, her body's changing, she's seeing little physical changes, but the hormones now are playing a big part of how she sees herself, her self-esteem, how boys are reacting or responding to her, the power of her body, the power of her feminism. All of that starts to take priority sometimes over the intellect and over the ability to be smart, to be focused, to accomplish. And it's very difficult, and very often girls will allow themselves to be objectified, thinking the confusion about the power of their bodies, and then the ability to allow themselves to be objectified by boys, and thinking they're going to love them.
Right.
And our desire to be loved is extraordinary. It's very different from boys. To be loved, to have a big diamond ring, that I am loved more than you are. Or my wedding, look at how I am loved. This guy loves me. And all of that impacts how we behave as women. And that's the beginning of the self-esteem issues and objectification. And that is such a critical time. And by not understanding the power of hormones in our behavior, we're not able to get back to square one when we have that first horrific experience with a boy. Or the embarrassment,
right?
Or whatever it is that's happened. And so I think really identifying each of these stages. So just to sort of dig a little deeper, so now we're out of puberty and sort of adjusting and being attracted to boys. I remember kissing a boy at 11 and not knowing why I was excited. But I was terribly excited, and it threw me off a bit. I mean, I was very studious, and I'm sure you were the same too.
Big time.
And so there's that throw off. And then you are going into your 20s and still developing, still understanding that this body that you've developed and the way you express yourself through clothing and makeup is another part of this. It's almost like the hormones are directing you. What is happening in that sort of development time, in when the girl now may be coming to your office and she's becoming sexually active? What's happening at this point?
Well, it's really interesting, and I much to your point of what you mentioned, and you talk about objectification. I think when I grew up, you could either be, a student, a nerd, or you could really care about your appearance. The two were totally separated. And I remember my mother really giving me a very hard time. And, girls like you don't go become doctors, right, and so on and so forth, make up your mind. And I was really sort of felt I'm going to do this all. And I think we were perhaps the pioneers in terms of showing people that we could be accomplished, we could care about the way we looked. And just because we cared about the way we looked and we wanted to exercise and eat well and take care of ourselves doesn't mean that we didn't have the same drives or interest in, academic achievements and success with our respective careers. So I think young women embrace, hopefully, and I think it's easier for today's young women because they can do it all. They're encouraged to do it all. I think times are really different. So that they are faced with the fact that they are sexual beings. And for some young women, I think they have trouble sort of juggling, can I do this? Can I still be studious? And I think that for them, there are enough role models where they can actually strike a balance. I think for some adolescents, perhaps they have a more difficult time than others. in terms of, I guess it would manifest itself with perhaps insecurity, potentially promiscuity. But I really try to talk to my young patients. I love taking care of adolescents and discussing things like this.
What would you say?
To respect your body, really respect your body, and, to take care of yourself, and that people should respect you. And I also think young women are empowered enough today, and I also think young men, and I'm the mother of 2 young men, I think they're scared to death. I think that, they know that they need to be respectful of women, so I think it's a little bit easier for women to balance both things, femininity, their changing bodies, their interest in, sex, they're embracing their sexuality, as well as achieving things.
Mm-hmm. Plus, I think girls are more aggressive now.
Oh, definitely.
And so maybe, we may be tipping over the scale a little bit in aggressiveness, but it'll balance out.
The pendulum will swing back, and I've thought about it.
But I do think once you become sexually active, there's a different responsibility. So obviously you need to go to the gynecologist. You need to do regular visits. Now you have entered that zone. You decided to be an adult with your body. Right. And so then there's the conversation about birth control. Clearly it's the family's responsibility to make sure that the responsibility of having a child is an extraordinary one.
Absolutely.
And what does that mean as far as the responsibility in your body? So when it comes to birth control or prevention, what type of conversation have you had with young girls?
So it's really interesting. It's amazing how many, some of my young patients come in because they want to be sexually active and they're really open with their moms. And it's really nice. Now, granted, I practice on the Upper East Side of Manhattan. These are well-educated kids. They have great, relationships with their moms, their dads, who oftentimes bring them in. Sometimes, the moms bring them in because they know the young woman's going to be sexually active. And these kids are smart. They're really taught from a very early age, as are the boys for that matter. I remember talking about condoms when my children were in elementary school. I was a little bit, I was a bit of a renegade in that respect. But all kidding aside, so they're well aware of contraception. And it's interesting, in my practice, I've seen so many fewer unintended pregnancies. And I think a lot of that has to do with the fact that women are so concerned about STD prevention and STI prevention that they are making their partners use condoms. And obviously, they worry about undesired pregnancies. So in addition to condoms, many young women who are having sex on a regular basis will want something else. And birth control pills are very common, and the other thing that's really regained popularity, and I spend a tremendous amount of time speaking to the moms and trying to reassure the moms, are IUDs. IUDs are not the IUDs of the 70s and the 60s.
The good old copper coil.
No, they're totally reconfigured. American Academy of Pediatrics, American College of OBGYNs really endorses the use of IUDs.
Really?
As long. They're considered LARCs, long-acting reversible forms of contraception.
That's great.
Some of these IUDs are good for 3 to 5 to even 10 years, depending on which one a young girl opts to have. And they're great options for women. And I really try to instill in my patients, if they opt to use birth control pills or IUDs, they must prevent, STIs. They have to take a sexual history for their partners. It's not an easy conversation. Sex is messy. Talking about sex is awkward for all parties involved.
So on the birth control pills, we're talking about hormones.
Yes.
We're talking about the complexity of the hormones that we're living with and the effect of hormones on our bodies. So now, if you're a young girl and you're taking birth control, just to be clear so everybody understands what that means. So an IUD, you put it in. I remember having the copper coil. That's how old I am. I think it was the first one out of the box. But the idea of that was that I wasn't putting anything into my body, and that there was a chance here of having something that I didn't have to deal with
Right.
on a regular basis. So what is happening chemically to a female who takes birth control pills?
So first of all, just to get back to the IUD and the copper coil, other than perhaps making one's periods a little bit heavier, with the copper IUD, we now use something called, it's more of a copper T, but
It's
Paragard.
still copper,
It is copper-based IUD system. Paragard is one of the brands. It is non-hormonal for younger women or women of all ages. Sometimes their periods are a little bit heavier, but it is non-hormonal. It's good for up to 10 years. And usually the side effects, if there were any, perhaps heavier periods, maybe crampier. For women who are really dealing with heavy bleeding and they're really crampy, the hormonal-containing IUDs contain hormones that essentially can affect the uterine lining. So the result is that the uterine lining is not really built up. So when it comes time for a period, some of these women don't get a period at all, which they love, or they just have a very light period. So it's amazing, and it's it's reversible, and they don't have to remember to take a pill. But to answer your question, for those young women who are on birth control pills, first of all, it's not a one-size-fits-all sort of decision to make. A woman has to talk to her physician. There's certain pills that perhaps may be better if a woman is prone to acne. If a woman tends to have recurrent ovarian cysts, there may be different pills. For the most part, these are low-dose pills compared to the pills of the 60s and 70s, and we have some very, very low-dose pills out now. So it's trial and error. Some women notice nothing when they're on the pill. Other women notice more hormonal neutrality, if you will. Ovulation's inhibited, so the highs and lows that many women experience during the course of a ovulatory menstrual cycle, they no longer experience. And there are other women who really feel anxious and depressed on the pill. So when I'm starting somebody on the pill for the first time, I really go through all of this with them. I like them to touch base with me. I tell them it's not one size fits all, and there is definitely some trial and error involved.
Right.
But there are many women who are on the pill for years and years. Perhaps they'll take a break for pregnancies. Many women, as they age, are on birth control pills independent of wanting contraception. They like regulating their cycles. Some women like having what we call an extended cycle where they don't bleed at all. And it's great for women with heavy periods or crampy periods.
So I asked my staff, which is mostly women, to send me their questions that they would have liked to have asked. And since we're on this topic, I've been on birth control for 30 years. Is this really bad for my body? I'm 47 years old.
So absolutely not. Absolutely not. And I think that there's so many myths out there, and it upsets me to no end because, especially when I meet new patients, I feel that I can spend half of an office session debunking some of the myths. We now know, barring any underlying medical problems, women can safely stay on birth control pills until the age of menopause. Average age of menopause in this country is about 51 and a half. The interesting thing for someone in their 40s who has been told or thinks they need to go off the pill, it's the perfect time to stay on the pill because this is a time when women are typically perimenopausal. They have these highs and lows. Their estrogens, their progesterones are higher than ever before, lower than ever before, and they can become much more hormonally sensitive. So being on the pill sort of provides a hormonal neutrality, if you will. So I encourage them to stay on it. I really do.
So would you liken birth control to hormone replacement therapy, or is it in the same world?
So that's a great question. So with hormone replacement therapy, typically the term refers to giving women hormones after they've had their final period. And menopause is, by definition, occurs when a woman has gone a full year without having had a period. During perimenopause, cycles can become very irregular. And during those time periods, there can be hormonal lows where a woman really has trouble sleeping, night sweats, hot flashes, the things we typically attribute to menopause. So in essence, while it's not typically hormone replacement, it's giving you, as I said before, giving a woman hormonal neutrality so she doesn't have to experience the highs and lows. Hormone replacements typically, with hormone replacement, we use lower doses, which may not be sufficient enough to suppress ovulation, so someone might bleed around that.
So it's lower than...
Hormone replacement is lower than oral contraception.
So another question that I was asked to.
I love these questions.
They're great
I love
questions.
them.
So if you're in your late 30s, early 40s, and you're starting to feel like you're overheated, or can perimenopause start that early? Has it been?
Oh, sure,
yes.
sure. And the interesting thing is, it doesn't mean a woman's less fertile. So they have
Right.
to. They can't think, oh, I'm having hot flashes, I'm not going to get pregnant, because
she could very well.
absolutely. So, in terms of treating women, one always has to keep contraception in mind.
Yeah.
But essentially, our thermostat starts to break down, as it's the best way to describe
Right.
it. And as women get into their 40s, and for some women it can be their later 30s. Everyone is different. Some women don't become symptomatic until their late 50s.
Yeah.
And I've certainly seen that, but it is not unusual to have some night sweats, some difficulty sleeping, and especially before one's period, where hormone levels do drop down, some people do tend to have symptoms.
I want to emphasize the fact that that does not mean you can't get pregnant. My grandmother had my mother when she was 55.
Wow.
And my aunt had her daughter, my cousin, when she was 55.
A fertile
so
family.
When 55 came, I was like, lockdown, not going to happen. So yes, I think it's really important to understand that they're not necessarily, it's not the end of everything.
Absolutely not, no.
And it is different for everyone. One of the things that, before we get into perimenopause and menopause, which is a big part of
Sure.
what we should talk about, I am around a lot of young women who are very successful and becoming powerhouses and really significant players in the business world. And they just haven't met their soulmate. I mean, I was 65 when I met my soulmate. So we all have a different schedule. And to think, what are they going to do? Of course, at 30, they're having panic attacks because according to the schedule of life, they should be married and have a kid, and we know that that's not true. And so many, as you know, are thinking about freezing eggs. What's involved with that? What's the hormonal therapy and the work that has to be done with that? Can you share
Sure,
some information?
absolutely.
Because this and menopause are two big topics.
Absolutely,
So let's
absolutely.
give this some time.
I will tell you, first of all, my heart goes out. I think I had my kids in my mid to late 30s. I will tell you that I think in my late 20s and early 30s, if I knew women were freezing eggs, I would have been so anxious. I really, that would not have been a good thing for me. I think it's tough for young women these days, although, on the other hand, they really have great options. So my approach has always been, you have to look at a woman's social history. Clearly, if they're in a committed relationship and they're in their early 30s and they're contemplating having a family in the near future, I wouldn't go ahead and say freeze your eggs. But one thing I really have tried to make an effort to do with my patients who are in their early 30s is asking what their plans are in terms of having children. Do they want to have children someday? Some women don't, and that's absolutely fine. But for those who do, I think it's really important for them not to be pressured into finding somebody who may not be the right life partner just because they want to have kids. And the good news is they can explore the option of egg freezing so that they don't feel pressured. And the interesting thing, and I always tell my patients this, and I've really found this in my practice, it's the best insurance policy out there. I have yet to see any of my patients freeze their eggs and actually use them. They've all ended up meeting somebody and getting pregnant. The technology is still somewhat new, so at some point, yes, some of these frozen eggs may be used, but it's a really nice option for women to have.
And I think as women are more independent and we have to admit that the role of the male-female relationship was, one will be in the workplace and pay for everything and support everyone, and then the other will raise the children, and that role has been turned upside down and mushed around. And so now there are many women who are the breadwinners, and
Absolutely.
many women who are playing a big role in the male perceived concept of
Sure.
what that relationship is about. And one of the big things I hear is, I always thought this guy, the guy I marry or the guy I'm with, was going to take care of me, but I realize now that I'm the breadwinner, but I want to have children and I can't do it now. And so the egg freezing is a big conversation, and it's one that everybody is talking about. One of the questions is, at what age is, the ultimate best age to freeze eggs, and is there an end date to that?
So that's a great question. The truth is, it really has to be individualized. Clearly, the younger the eggs are, the better. But I certainly, and I've had friends ask me about their daughters in their late 20s, and I'm like, no. I think realistically, early 30s. The interesting thing is there are some screening blood tests that can be done. They're not perfect. The reproductive endocrinologists who do, infertility exclusively can speak to that. But there are tests that can give us a sense as to ovarian reserve. And if a woman has a question, is this something they should consider, then it's worthwhile doing these screening tests, which may also be, combined with an ultrasound, I think optimally done by someone who does infertility medicine to determine, is now the right time? Is this something that a woman may have some time to think about? Mm-hmm. And then the other thing is there's a difference between freezing an egg versus freezing an embryo. For that woman who may be in a committed relationship, but doesn't want a child now, many women go ahead and do IVF where they have embryos, fertilized eggs, which then can be frozen and then reimplanted at a later date. And today it is not unusual for women to actually, the part of the IVF process includes actually freezing those embryos, testing those embryos for genetics or, right, other things, and then reimplanting them once they've been pre-screened, so to speak.
Yeah.
So again, everyone is different. There's no perfect time, but clearly the younger one is, the better.
Women have to understand that there's a big road ahead.
Absolutely.
If they want it. If they want,
yes,
a long, healthy life in their minds, you can sort of get in that direction if you are aspiring for that, and having goals. And having that kind of a goal is very productive for women. So it's so great that you are such a great proponent for empowering women and giving them an opportunity to realize their potential, and that you've now moved to this